Hello, everyone. Um, I hope you're all doing well. Um, so today it's not Rana who is in my seat. So for those of you who don't know me, so I'm Yanis. I'm the product manager at Balliston. So I'm just here to press the play button and let Chris do his magic. But I thought it was interesting for you to meet me and to hear about me. So thank you very much for attending and for registering. I know some of you already. So Chris Ramsey is here today. So you're gonna have your
I
your
know, right?
your questions.
We'll have questions.
um, so we have some usual people here. So welcome back, guys. I see that Pavla also is here. Hi, Pavla. So hi, everyone. Thank you for being here. If you can say hi in the chat, where are you guys all coming from? It would be great. And hi, Chris. Thanks for being here with us today. And
Absolutely.
yeah, I let you start whenever you are ready,
All right.
and share with us your insights and your knowledge.
We shall see. I know everyone's probably a little concerned that Rana's not here, but there's four guys
She's
can.
fine. She's fine. No worries. She's okay.
No,
It's
no, I
just
mean
that so,
concerned that we can't do this without her.
Oh yeah,
But
yeah.
we'll be okay. We promise. We'll be okay. Um,
Perfect.
but yes, I was glad to have Giannis on. Like he's one of the brains behind the product and all
One.
that. So one of for sure, but and
Yeah.
excited because we've got some really cool stuff coming that I won't say yet or what, but really cool stuff.
Yeah, we
So
will. We will most likely do a webinar to
soon,
present like the new
yes.
things and stuff. So yeah, yeah.
Yes, absolutely. But all right, so we've got Belgium, we've got Czech Republic, we've got South
South
Africa.
Africa.
Awesome.
Yeah.
Awesome. All right. So for those that don't know me, my name is Chris Prue, and I'm here located in the United States on the eastern side of the country, so just north of Boston, Massachusetts, and a little further away from New York City, but that's the time zone that I'm in. So this is a monthly webinar that we do. We took some breaks and then came back, took some other breaks, came back, but we're back at it for 2026. And what we do is we kind of choose a use case example, and we take that through and go through the product. And so it is very product centric. So I talk to you folks as though you kind of know about the product, maybe have the product. And really the goal is to just kind of be able to present it in some different ways, maybe give you some ideas of how you might be able to use it, and just overall part of the interpretation piece as well. So at the end, we will take some questions, and you can either put them in the questions or the chat, and we can read.
Yeah.
But between the two of us, I think we know 3 or 4 languages. I know one, and then Giannis knows the rest. So, but yeah, English
No, you
or
speak Spanish also as well, Chris.
muy un poquito, and très un peu en français. So a little bit of both. But
Yeah, this one
anyway.
you can leave it to me. No worries. You can leave this one to me.
All right. So, when we were looking at this, and I was excited about this topic because I love to look at and evaluate, products, and some of you know that I used to be a full-time professor in a lab, a biomechanics lab. So I have a doctorate in chiropractic, and then I have the certification in sports physiotherapy, which in this country is known as an athletic trainer. I've been a performance strength coach for about Ooh, I was just telling my students I took that certification and actually started working in that back in 1994. So I know everyone's like, he looks like he's about 35. I'm a little older than that. And then
Yeah.
my master's and PhD work are in performance-based outcome measures in exercise science and biomechanics, and so that's kind of the direction I take from this. But I work as a practicing clinician and performance coach, so I kind of cross those bridges. So this month, like I said, I was excited because I was asked to evaluate a new product, which is this right here. And it is a brace. It's an ankle brace. So your toesies go in here. What's unique about it is it's a progressive brace. So it's designed from post-surgical, where you do not need complete blocking or limitation to movement like wearing a boot or in a cast or something like that. So it has a silicone mesh to it that provides a little bit of comfort, but has different levels of these completely rigid stays in them. So you can somewhat block the ankle. And so the idea is, as you're going through rehabilitation, you can configure it and change out the stays and make it a little bit more mobile as you're going through the rehabilitation process. And so I was asked to evaluate this. I don't know if it's on the market yet, but that's why I blocked out the name brand. But what I wanted to do is look at it from its most rigid configuration, and that's the scenario that we're going to look at now. And those of you that have worked with bracing and supports in the past, you know that if the rigid components of it are not connected, then there's going to be a limitation in the rigidity of it or its ability to really block certain types of motion. Now, in particular, this is designed to really allow for sagittal plane mobility, so dorsiflexion and plantar flexion, and mostly attempting to sort of block inversion and eversion, which, if you're familiar with our product, we measure that. And in fact, I don't know what Giannis would say, we probably measure it better than anybody else in terms of it being in a shoe. And what I mean by that, and I use motion capture as well, is the actual orientation of the foot relative to the ground surface. So I'm going to share my screen and just go through a couple of a couple of slides here, as I always do. Let me pull up. Nope, let's do the entire screen just in case. And then we should see a little bit of some matrix action. I was watching John Wick 4 on the airplane coming back again last weekend. So reminds me of
doesn't surprise me
of my boy. Okay, so nope, not that one. Although maybe we could have some rate of force development discussion at some point. But all right, so
next time.
Next time, yes. All right. So, as I said, we're evaluating the effectiveness of a rigid ankle. I call it more semi-rigid, and really, again, its intention is to sort of block frontal plane motion, inversion, eversion, and then subsequently could have an impact on supination and pronation. But so this is just kind of what we were looking at. That's the brace. We were using the Ballast and Health product, formerly Digisol Pro. The subject, male, left chronic ankle instability with impingement syndrome and cuboid syndrome, but has been going through rehab already. So I was kind of interested to see, what would it do? Now, I could have done this on a normal ankle as well. And you'll see when we look at sort of the pre-data that it really wasn't that bad. I mean, the support that he's experiencing is actually pretty good. So we looked at walking gait, we looked at the single leg hop, and we did left and right, and then we did counter movement vertical jumps. And so what we're able to capture from this is we can look at with and without the brace, but we can also look at and look at the symmetry compared to the right to the left. Now, man, especially in sports science, we're looking at symmetry very aggressively now. I mean, we've gone through phases. Now we're looking at asymmetry being a little bit more characteristic, especially if you are a particular type of athlete. But think about this in terms of something like walking or gait, where that is a little bit different, at least in consideration. And maybe another day we'll have a bit of a discussion about that. And then just looking at range of motion and dorsiflexion and plantar flexion, inversion, and eversion. So the goal was, like I said, we were looking at whether or not this brace was really supposed to do what they said they would want it to do. And supposedly this was the perfect or the exact fit. And everything worked appropriately. It was put on appropriately and things like that. So we're trying to figure out if it would limit, because there's the potential of using some of these braces, prophylactically. And actually, I was just having a discussion with my biomechanics students yesterday, and we were talking about that because obviously it's ski season right now. The Olympics are going on, and I used to work for a large company that made braces. And we started using that in the development. And again, back when I started working in clinic, we would fit people for, semi-custom braces when I started back in the early 90s. And then, of course, today we progressed with the materials that we're using, and as well as, being able to evaluate and do some better customization. So with the fabric that's utilized for this and being silicone, it has much better conformity to it and really should, kind of fit. And I'll cut to the chase that the fit was good. It was considered to be, comfortable. The stays, the rigid portion of them, they conformed right over the medial and the lateral malleolus of each one, the malleoli, and so it was in the perfect position. You can adjust the fitment, the tightness to it, so it was comfortable, but about as secure as we could possibly get it. Now, I'm just going to run through this real quick. I started putting all this data in and then realized it was a waste of time, or it's not as pretty as looking at the output, which we're going to go to in a second. But just for quick comparison, yes, I know. Just for quick comparison, so we looked at, this is just walking and looking at symmetry between with and without the brace, and we went from 92 to 88%. Now that does put us into that category where it's an asymmetry that might be characteristic of something that might be a little bit more problematic. Now, here's why that's not necessarily a bad thing, because if I was restricting good normal motion, it should have, somewhat of an impact. But as we see, cadence and speed didn't even really change. And then we look at the relative stance percentages and the temporal, characteristics of the gait cycle, and we see that again they're pretty equitable. And this is just looking at the side utilizing the brace. Again, fairly consistent. When we look at the right to the left, or the symmetry or asymmetry characteristics, there really weren't any. So pre and then post even wearing the brace, there's an inch difference, which is 2.54 centimeters in the step length. So I'm not sure I would consider that to be different. This was overground, so it was self-directed speed. So it was not on a treadmill, but that's pretty cool that we're seeing this level of consistency, including things like the clearance. Again, typical clearance. And this is actually a good thing, because as I mentioned earlier, this particular brace is not really meant to block any motion in that frontal plane. So they should have normal plantar flexion and dorsiflexion. The steppage angle, again, pretty close. I don't think we can really establish that there's much of a difference in there. We'll look at the pictures, and we do see some differences when we're looking at some of these other characteristics. But let's go over to the system, because that's prettier to look at. And I think I've got it up right here. Okay, so those of you that might be new to this is the dashboard. Now, you have an app that you can use on iOS or Android to collect the data as well as view the data. I like to go to the online app because it's a little bit more robust. Just find it easier, and I'm old, so I like using computers still to be able to make some of these comparisons. And that's the big thing too, is being able to do that. So you have your workspace. It tells you who's in that workspace, who's active in that workspace, I should say. Over here in the left-hand column, there are some things that you can make changes to. The home, I don't want to get out of this, but the home screen just kind of shows you the latest evaluations that have been taken. It'll flash and say, who's in that particular workspace. Obviously, this is the patient, and it lists all of those patients, and you can click on each patient, and it will show you the information. It will also provide you the latest evaluation that you've taken. The equipment, it shows you the sensors, so you can have multiple paired sensors to a particular license. And also you can make changes in the settings. Obviously, I'm here in the United States, so when I use this to show the patients so they have a sense of what it is that we tested and what the outcomes are going to be. So you can change metric to imperial. You can change your language and things like that. So when I click on the dashboard, it just shows me the most recent and gives me the top most recent analyses that we've taken, which in this particular case is going to be the ones that I am about to show you. In the patient file, that's all the patient characteristics. And that's important because when we look at the patient characteristics, they're utilized in the analysis as well as the output. And so what this does for us is it allows us to run the algorithms to provide the data and the normative values relative to the gender, to the age, height, weight, and those sorts of things. And that's, for example, how we know some of these calculations using an IMU. So you know that we're using these little sensors. I have an example here. They're smaller than that, but they fit inside of an insole that we put inside of the shoe. And so we're using an inertial motion unit, gyroscopes, accelerometers, and with that, we can use various types of algorithms and calculations to get all of the data that we actually get. So there's no force sensors inside of there, no pressure sensors, but we can extrapolate some of those using certain types of equations. It's not different than, using a force platform to calculate jump height, for example, in a counter movement vertical jump, where we do have the ability for known values like the effects due to gravity and things like that. So you can put in their information here. You can put in some of their conditions and other data. And the reason you might want to put this in is over time, or if you're going to share this data with somebody else. The practitioner analysis is going to highlight and show me all of the analyses that we've taken with the particular individual. So we're going to be looking at the walk first. And so the walk, let me move the screen up here. And so the walk gives us, your basic spatial temporal parameters that you're probably familiar with, which is going to be your stride, your stance times, your swing times, your relative percentages, and things like that. So we'll go through that in a second, but you'll notice the colorations. So we use different colors to quickly inform the user of some of the information. So when we see something that's in green, it means it's within that standard deviation of the normative values that have been established for that particular age, gender, height, and so on. And then if we see something in amber, that means that they're somewhere between 1 and 2 standard deviations. And if it's in red, then they're greater than 2 standard deviations. So the purpose of this is if I see it in green, then I know that it's fairly normal and I don't need to spend a lot of time evaluating that. And so that's part of the user experience, because we don't, I won't say we don't care, but as a clinician, I don't want to spend a whole lot of time doing paperwork and looking at things that otherwise, might be used taking that time and used elsewhere. So we see that in the symmetry at 92%, we're approaching, we're 8% off. And that's where, that particular metric has some indication that I at least want to think about that. In other words, looking at some of these differentials. And what that will do is that may cause me to go down here and potentially look at a little bit more detail with regards to the profile. So we see in here that the stride length between the two is actually quite similar. It's only off by, a half an inch, so 1.75 centimeters. So that's not a whole lot. But what I'll do is I'll click on the advanced and maybe I can get a little bit more data. So what we see here is the stride duration, at least from a time perspective measured in milliseconds, is smack dab in the middle, as we say. But what we do see is the stride length is a little bit short. So again, that's going to be relative to that particular person's configuration, their stature, their age, their gender, and things like that. So a little bit short of a stride length. Yeah, it might have something to do with the speed. It might have something to do with where the environment. So it's a fairly long hallway, so there's plenty of space. So it's not that people are concerned with falling over. Could be their age, could be they have pain or whatever the condition. This doesn't tell you that, and that's why you have these ability to write some of this information in. But again, at 2.7 miles per hour, that's actually a fairly normal speed. It's kind of on the slow end of normal. I like to see people that are adults walking at least 3 miles per hour. And so that could be an indication. And that's a reason, I talk about this a lot too, where you might want to consider using a treadmill on occasion. And I was just at a large physiotherapy show in California, and there was some discussion about how someone was saying, well, you should never use a treadmill because it's not characteristic of how we normally walk. And that's fine, but there's some things that we can get from a treadmill, like we can actually control the speed. I can do dual tasking, I can do overspeed and things like that. So really, it kind of depends what you're looking for. And this is where we start to see some of those differences and why there was an 8% asymmetry. So on that left side, we're actually within the normal swing time, but on the right side, we're a little bit on that short side. So one thing I talk about when we think about this concept of symmetry or asymmetry, especially something like walking. And again, what we're finding in sport performance is that asymmetry is not, at least in certain types of metrics, is not, as a concern as maybe what some people thought. I still look at it rather deeply, especially when an athlete, I start with walking. And the reason why we start with walking is everyone should be able to walk without even thinking about it, especially someone who can, perform at much higher levels, being the athletic person. So even when I'm going to evaluate a runner, I always do a walk first, because that's going to be your perfect baseline. It's a vital sign, right? So we talk about this a lot where, anytime someone comes in, we're going to measure heart rate, blood pressure, temperature, respirations, things like that. We're also going to measure walking, even if we're going to have to look at them, say, return to play, post ACL or something like that, and they're way beyond, just walking. So why would we see a reduction in swing time on that right? Well, when we do see certain limitations, and as I told you, this person's kind of coming back, and I should have showed you something, from several months ago where this left foot did not look good at all. And so this is actually really progressive, and their stride lengths, were dramatically different. But definitely something to take into consideration. And that's where you, as the clinician, you have to think about this for a little bit, where I told you it's the left side that's problematic. Well, why would you see a reduction on the right side? Well, keep in mind that, the weaker side is always, as we call, the weak link, right? And that's why I always go back to thinking about this concept of symmetry, especially in things like, if you have a sprinter, they probably shouldn't be like a soccer or tennis player where they are handed, right? Where they have a dominance, and they hopefully are very, very similar. And so when we start to see some of those asymmetries, that can be problematic. And so the gait line, so that's the center of pressure. And again, as I mentioned earlier, our sensors they're not pressure sensors. we're using an algorithm based on foot orientation in correlation to pressure mapping. So we've matched that up against, with Yannis's team, we've matched that up against the algorithms that we're able to use. So it's not as accurate as if you were using a pressure. What we did was we wanted to just give some relevance to and provide an orientation of that foot as it's going through that ground contact related to center pressure. Why? Because a lot of people are familiar with that, and I know that we've got some very high level, podiatrists on here and other people that specialize in the foot in particular, and so that's a characteristic that many clinicians are very familiar with. And then the propulsion rate. So the propulsion rate is the ratio between the hip flexors and the plantar flexors as you move into that swing phase. And again, we're not measuring actual muscle activity, but it's relative to other characteristics, which is the velocity and the acceleration as you're going from toe off into that swing phase. And some interesting notes is, when we test older adults, they tend to walk slower, and they also tend to favor things like plantar flexors. So we'll see lower activations in the hip flexors, or people with low back pain. People with low back pain will have a tendency to reduce activation in the hip flexors because of the torque it provides against the spine, further exacerbating their problem. Or a foot problem, they may not want to plantar flex and push off, so we'll see a higher engagement of the hip flexors. Okay, so, and that's actually what we see here. Now, this is, again, we're not measuring it, so it's not as sensitive if you were to measure that. So think of it, I won't say lower value, but at least it puts in my mind that, 6%, with regards to engagement in the hip flexors. Like I said, it matches up with this particular person having some problems with their feet. So then when we click on details, so this is the pronation supination angles that I was referring to earlier. If I click on advanced, it pulls up a much better graphical representation. And so what we see here in this green pathway, we call this the corridor. And this is really a normative corridor, right, between the mean or the average and the standard deviation. So the middle line that we see here, the thicker black line, is going to be the mean or the average. And these thin lines are a form of variance. So we're looking at variability in terms of standard deviation. Okay, so we typically don't want to see something so tight because there should be some degree of normal variability. And we find that, within 2 to 6% typically. If it's too wide, we're seeing too much variability. And the reason we may see that is a lack of certain motor control. So when we see it fairly tight and normal, it means that they're good at that. And again, this is walking at normal speed, so they should be pretty good at that. This also tells us that they've conformed to this particular pattern. For some reason, it opens up here in this toe-off situation. I have no explanation for that. No, it could be their shoes or something like that, or again, something that is changing in particular. So this person in particular, we're seeing they're fairly normal within that corridor. But if I showed you one from earlier, when they went into foot flat position, they were more about -15 or so degrees, and they would ride that lateral aspect all the way until they came into the toe off position. So they had a really large tendency to invert or over supinate. And so that's also what's a little bit unique. And this, I call it somewhat proprietary, where people will ask, how are you able to measure pronation and supination? And the way I answer this is, it's sort of, again, it's using an algorithm or a model based on the use of the algorithms for an IMU. So that position is just a little bit inferior than the midfoot region. And that's on purpose, so we could actually calculate and create this. So think of it more as a combination of looking at almost like a block model. And again, the purpose for this too is we're wearing a shoe. So when someone would be wearing a shoe, to really identify specifics with regards to pronation and supination, that midfoot triplanar action, um, one, you probably want to put a bone pin and a marker on the navicular to really be able to do that. But a footwear or shoe is going to block that anyway. And that's why, I like this, because it really is representative of whatever it is that's on their feet. And so we can use that characteristic. So this green corridor is something that is developed as a normative pathway based on this specific system and the calculations that have been taken with all the normative values that we've seen. You'll also notice in here that if I put my cursor on there, it tells me that specific angle as well as the variability, right? So it's a mean of negative 11 degrees, and it's a standard deviation of 1 degree, right? So that's actually pretty good, and that's quite normal. And you can see that the trajectory of these variable lines is actually really, really good and consistent. On the right foot, we do see it opens up a little bit on toe off again for some reason. The other things that you can look at is it's broken down into the 3 different positions during foot stance. And again, it's using a coloration to show us whether or not it's within normative values, between 1 and 2 standard deviations, or greater than 2 standard deviations. And that's what we see here in red. Right. So really, really short. So they transition from heel strike to foot flat. They put that foot down pretty quickly. And then we also see that in the mid stance. So they spend the majority of they spend more time relative to the normal position in that mid stance time. And that kind of makes sense, because if you think about their problem and what that cuboid does, not quite as much when we're in foot strike, but especially as we're going into that toe off position. But that's something that it's been a lot. It's been months, over a year, in fact, of working on that particular thing. So that's actually a good thing. And then we look at the foot progression angle. So that's the relative orientation of your toes as you're going through the swing phase and looking at that. So we tend to find -2 to 14 degrees is something that we see in the literature as somewhat normal for asymptomatic population. So pretty normal when you look at that orientation. But we're a little bit different between the right and the left. So we do see some flaring out or external rotation. It's either hip oriented or possibly foot. I will tell you it is foot because of the problems that they've experienced, but it used to be much greater than that. So this is actually something that we've worked on and is working really, really well. And then this is looking at the foot as we're coming into heel strike or foot in, and then from toe off. Now, this was without the brace. So what we can do here, when you click on these 3 dots over here, is we can do a comparison. And that comparison allows me to put 2 of these side by side. So I can put it together with the other one that the person is wearing the brace. And this is where we can do that comparison. So this is very acute. It's within the same session. So it's in the same day. So we see that, yeah, there was a little bit of transition. So the nice thing about this is the dashboard shows me instantaneously that, okay, so we do see some differences in symmetry. And again, I would expect that, because if you were normal and then I put something rigid on you, we're probably going to see some abnormalities with regards to that. So let's see if we can find out where that is. And if we look over here, pretty consistent and pretty consistent over here. So there's not a whole lot of difference. And again, that's where I said 92 to 88 may not be, that significant. So we see the stride durations are fairly similar. We see the stride lengths are fairly similar. We see the swing times is again, that's where we're seeing that characteristic. So what happened? Well, the swing time with the brace lasted longer. And if you think, wearing something rigid, and if even though you're supposed to have some good mobility in plantar flexion and dorsiflexion, you're still wearing something that's blocking that hinge somewhat. So that makes more sense where they don't have that capability to do so. Stance time also looks very, very similar. We see really not a whole lot of difference with regards to the center of pressure. So in other words, I guess the brace wasn't really creating much of a difference with regards to orientation in that frontal plane. We'll see more of that detail when we look at pronation and supination. Pretty much the same thing when we look at the propulsion rate, right? So there's just, if I look closely, it's a 2% difference, 3% difference here in the on that right side. So I wouldn't really consider that different. But what I do like about that is it's showing consistency. And I'll cut to the chase. In the end, the brace didn't really change a whole heck of a lot. And that's representative of even what we're seeing here with walking, let alone some of the jumping characteristics I'm going to show you here in a second. So on heel strike, 16 and toe off is 4. With the brace, 19 and toe off is 5, right? So a 3-degree difference on heel strike or foot in, and really, again, only a couple degree difference. And so not a whole lot of difference with regards to orientation. In other words, it wasn't really changing in that frontal plane, and that's under normal circumstances. Now, maybe if the person did have a problem or a large deviation, it might be more problematic. So then when we look at the foot progression angle, it's about the same. So what, 0.5 difference. So not a whole lot of difference. And again, you're probably getting the point here, at least in walking, where there's not a lot of extra loading going on and a fairly normal gait to begin with. There's not a whole lot of blocking with regards to some of those characteristics. Where I would expect this to have more of an impact. Now, let's think about this from a slightly different perspective is, okay, so when I put this on someone who's walking normal, and I did want to wear it maybe a little bit more prophylactically, they have a weakness and they need to go hiking, but they're not full strength yet, they can at least know that if they put this on, it's not going to be detrimental to their normal gait pattern. So that's a way to look at it as well. So let me pull up these jumping characteristics. So one of the things to note with, and we're going to look at the counter movement vertical jump. And I did 2 trials. It doesn't really matter. They're pretty much the same. But more so, I want to go over these characteristics. So a lot of the biomarkers and metrics that we look at are going to be the same throughout all the jumpings. That's kind of the easy part. And obviously, that some of these jumps are a little bit different. So what we did here is we did a counter movement vertical jump. So that's where the person is starting in an upright posture position. They descent rapidly into about a quarter squat position, and then they ascent very quickly, rapidly, and they try to jump as high as they possibly can. Because we have a sensor in each foot, we actually get flight time characteristics for each foot. So we see that, we've got a 17 millisecond difference between the right and the left. And a lot of people are like, well, how is that possible? Did they leave angled, or no, they were probably pretty much straight up. So one of the differences and the reason that we often see this is due to the degree of plantar flexion, where if you've got more plantar flexion on one side, that's going to stay in ground contact a little bit longer. And that could be why we're seeing a shorter flight time on that right side. Okay. But we'll look at that in a second. But that's what's interesting is it gives us that characteristic, and it tells us which one it's favoring. So we've got 17 more milliseconds time on that side. The other is if you are landing with a flatter foot than landing with more of a plantar flexed position. And then, of course, it gives you your jump height. And the jump height is going to be the displacement in the center of mass. not with each foot. So then the general parameters that we look at is we can look at, this is what I was referring to earlier, we can look at the flexion angle at takeoff. And so plantar flexion actually was at 33 degrees. So you got to wonder, why is that? Well, again, the range of motion is not being blocked supposedly on that particular side. So what could be another reason? Well, they can flex at the knee, they can flex at the hip. They are two different legs, and so they're not going to be exactly the same. But think about that for a second. 17 milliseconds is really not that much of a difference. Okay, now let's also look at the takeoff velocity. So that is looking at the angular velocity in plantar flexion, right? So we're looking at 510 degrees per second, and we're looking at 477 degrees per second. Now, this is where, like, there's no normative data. So this is up to you. This is where it's also beneficial to have some pre and post data to show, whether or not something is really different or is significant. And I won't take the time today. We're going to do this one again, go into a little bit more detail, some jumping characteristics, but we do have some indication as to what some of these should look like. As you can imagine, if someone is a really good jumper, they do go into and they capitalize on plantar flexion. So it wouldn't be unusual to see 45 or 50 degrees when we're looking at the flexion angle at takeoff. So 33, not great. 23, definitely not great. The other thing we can take that into consideration is, do they have ankle pain? Are they weak? What is the potential problem? But this is something I can show them and say, by the way, you're not capitalizing on that. So there are some exercises, there are some things that we can do to potentially change that. Same thing with the velocities. They're at 510 degrees per second. Sounds fast, but in comparison to throwing a baseball, a pitcher in major leagues, their arm is moving 6,000 degrees per second, right? So that's pretty fast. So this is not overly fast, but it's fairly symmetrical. And then we have this contact stability. So the contact stability is looking at when the person comes into ground contact. Sorry, I just changed the format, so it's right down here. So the contact stability is looking at when they come into ground contact within the first 250 milliseconds, how far do they move and how fast do they move relative to their repositioning. So the way I think about this, or the way I tell people about that, is this is something new. Like, not everyone is familiar with this, but if you've ever heard of Romberg's quotient, right? So we know that, a Romberg's test looking at center of mass displacement. So a Romberg's quotient is looking at the displacement and looking at how rapidly they get back to where their center of mass is supposed to be. So basically it's a variability or a deviation, the standard deviation off center of mass, and how quickly they get back to that repositioning. So here's why we're looking at that. And that's actually, I was presenting on rate of force development and stuff like that to my students yesterday in that other graph. And the reason is because there are certain time frames that are important. Within 250 milliseconds is probably going to be the time frame at which you or your athlete is going to be changing direction and determining whether or not they're actually going to be in a really good stable position and which direction they're going to go in. And actually, I sometimes show a case where I actually have on film a kid who was plantar flexing and inverting his ankle during the 30-second side hop test. And what's super interesting about that is they were already back up into their ascent phase while their ankle was still going into inversion. And so, I don't know, if you're a geek like me, that's interesting to look at and where, things went wrong sort of neurologically and biomechanically. Okay. So what do we see here? We see that they shifted by -4 degrees. So they went into that eversion position, and they did it at 138 degrees per second. So what we want to see here is we want to see the smallest number possible, right? And if we think about, the direction at which, we want them to go in, we don't want them to over invert. And I'll show you on the hop here in a second. So a couple other characteristics that we have in all of these jumps is we have max acceleration rate at landing. So think about this like landing force, right? We talk about that especially in running. So that's the acceleration rate as they're coming into landing, 2.4 Gs versus 2.8. Pretty normal because they didn't really jump that high, and that they weren't terribly asymmetric. And again, we see that in some of these other characteristics, right? So this is the angulation that we see also during landing. So this is in plantar flexion at 23 degrees and 23 degrees. What happens is they should almost mirror, right? Because if we look at the hyperbolic nature of the center of mass trajectory or an implement going up and then coming down, these tend to be somewhat similar. If I see a really, really low number in here, it means that they were coming in and basically landing in neutral, which is not good. Something else I talked about with my students yesterday is the impulse that we want upon landing is we want to elongate that, right? And we want it to be soft. And so there are really good studies looking at the contribution of the plantar flexors with regards to this. In other words, it's about 20 to 25% of the contribution in landing, in dissipating that energy, as well as even takeoff as well. Obviously, there's going to be knee extension, there's going to be hip extension, and some mobility in the upper extremities, such as shoulder girdle elevation. But that contribution in that lower extremity is still important because it's enough to make a difference with regards to dissipation. And then the pronation and the supination is looking at the foot orientation upon that landing. And so they're coming in and they're landing toe first. So typically they're going to be in a somewhat supinated heel inverted. So it's the same representation of the positive or negative. So if it's negative, it's going to be inverted or supinated, just like we see in the graph that we do in walking. So let's pull up the post because we can do the same thing here that we did with the walking, where we can take two and we can go side by side. Let me make sure I've got, it was going to be a later one. Okay, so these weren't pre and post. These are wearing a brace, not wearing a brace. 6.5, 7.6, interesting. So jumped about an inch higher. And that's also representative. We do see a longer flight time, and that makes perfect sense. So I don't know, maybe they felt more comfortable doing the vertical jump. And then let's look at the comparison. So this is at 123. So this is without a brace, and then the bottom one is going to be with a brace. Really not much different between them, right? All the numbers are fairly similar, although this is interesting. The contact stability, so they moved when they landed without a brace, they moved into further, -4 degrees, further into heel inversion or pronation. This is what I'd rather see is we see here they move to 1 degree. So that's a fairly neutral position. So we might construe that maybe the brace was doing its job at that moment in time. It didn't move a whole lot. That's a good thing as well. And so that means that they landed more neutral and they only moved 1 degree further into that neutral position at 6 degrees per second. So now if we go into the advanced, we can just simply compare all of these characteristics. So I like this a lot, the rotation around the z-axis. This is like the pronation angle. So this is looking at the degree of external rotation or toe in, toe out position between the takeoff and the landing. So they should be somewhat similar, right? Because we don't want to see large deviations And that would indicate either faulty takeoff and or faulty landing. So 1 and -2, and then we see 0 and -3. So again, pretty similar. And again, I wouldn't expect a brace to really make that much of a change. Let's see, pronation, angulation during landing, -8 and -10. And we look up here, we've got -6, -5. So again, not really much of a difference. So I don't think that we're not going to gather a whole lot from that other than maybe the contact stability. And we see that when people are wearing stuff anyways, it kind of potentially helps that. So let's quickly look at the hop. So the hop is a single leg horizontal hop test. So great symmetry, only a 1% difference, 39.1, 38.7. And again, we've got 2 sensors. And so this is where we get some neat characteristics as well, because this particular field test is designed to look at anything less than 10% is considered to be symmetrical with regards to distance. But what's interesting is sometimes people have differences in trajectories, right? Their angulation of takeoff when they go into the air. And so we see that this is the distance, that's the horizontal, but there's a neat characteristic over here. And we have this also in the triple hop, is we can look at the jump height. Because if we look at some of the differences, and there are no differences, but yet this person jumped 0.8 of an inch higher. So you would have thought that maybe they had a little bit longer distance, but that could be why they didn't jump as far horizontally, because they jumped higher than they did maybe further. So we can look at that trajectory. And so this is more characteristic. You would even see in a horizontal jump, you would even see even more plantar flexion. It wouldn't be unusual for them to be 60, 70 degrees in that plantar flexion. Similar characteristics with their takeoff velocity. The pronation, supination angle at landing. Here's what's different is when you typically land from a horizontal hop, you often land foot in with your heel strike, right? Which is a little different than when you're doing counter movement vertical jumps. And again, contact stability also looks pretty decent. So what we can do here is we can also do that comparison between the hop with and without the brace. And that's this one. And again, I can already tell you, I wouldn't expect to see a whole lot of difference just because we saw that in the vertical. Although here's what's interesting. We do see a distance difference by looks like about 5 inches, right? So about 12 centimeters, and that's kind of interesting. I don't know if it was the brace. I mean, obviously this isn't research. I would do another test just to verify, what that potential reason is. 200 versus 222 milliseconds. So they definitely jumped obviously less. The jumping height was very, very similar. So not a lot of difference there. Slight reduction in the flexion angle takeoff. The takeoff, down here. Similar here, slight reduction in the takeoff velocity. Not a whole lot of difference. And so my guess is it had more to do with hip or knee extension with regards to why they didn't jump quite as far. And then let's also look down here and we see that not a lot of difference between pronation, supination angle at -11, -8. -11, -6. So very, very similar. 1 and 3 on the contact stability, 3 and 4 here. Again, now, my expectation not to see a lot of difference if it's normal. And so my take from this is, one, because they were normal even without the brace, and you put the brace on, it doesn't magically make them superheroes. But what it does show me is that they could wear this brace and it wouldn't have either a performance limitation or potentially increasing their risk of injury because it didn't have a negative effect on their performance. So that's kind of the way to really look at that, is it didn't have, huge impacts on differences. But again, when we're looking at someone who was normal to begin with, and it shows normal in the wearing of the brace, that's actually important as well, because it tells us that there wasn't a limitation. And we're seeing that prophylactic use of braces in today in American football. And some of you may have seen my New England Patriots didn't do so well, but you'll see in high-level American football players, football, Australian rules, rugby, and rugby and Australian, they don't wear stuff because they don't need all the equipment. But our American football players, they wear a lot of knee braces. So anyway, that was a lot, but so we do have some time. I'm here, so we do have some time for some questions. And so Pavra, I wonder if they aren't anti-pronating. Yeah, and again, so that's one of the things when we're looking at the consistency in jumping. So there's more variability in jumping than there is in walking and potentially in running. So I kind of look at this as how does it relate to? So if in a perfect world, I would have also taken a running test if this was a particular athlete to figure that out. Symmetry difference is defined in the hip, knee, feet. So the symmetry difference is going to be in the gait profile. So, and I think they're going to bring this back. So the symmetry that's represented at the top of the dashboard, so that's specifically in the walking profile, and that's going to be contact phase and swing time. Okay.
Sorry, guys.
It's overall. So it's not just in the angulation. So it's the performance outcome in looking at that.
So Chris, Ramsey, if you don't mind, can you hear me?
Yep.
Yeah, I just had one comment because, so thank you very much for the data and all the information. Actually, I was quite surprised on the effect of the brace on the stability part, on the stability value of the jumps, because you could really see how it was improving that aspect. On the landing stability, it was always getting better numbers. So especially for someone you said who was like kind of good, we could still see that element that on one side was not that great, that was not symmetrical with a lot of variability, was getting much better. So even on very small details like this, you can see the difference.
Well, the other thing too is that, and this is where a control situation can matter too. And this is why I go back to potentially using a treadmill, and I would have had this person run, because when we do an over test, and then, if we encourage them to jump higher or jump further out and really challenge themselves, then that would be also very good information. But again, in that scenario, especially if they're not like this high-end athlete, it can be difficult to challenge someone. But on a treadmill, if we had them, potentially run, we might actually tease out a little bit more of those characteristics. But yeah, and this is why, and I didn't do it, but if I had done a triple hop, I really like using a triple hop versus a single hop. The reason for the single hop is the single hop allows us, it allows the person being tested to know a little bit more control. But in the triple hop, we're forcing them to what we call load and explode repetitively, which is why we can even calculate a reactive strength index. But what I often see in the triple hop is we see that trajectory in terms of abnormalities, for example. And so that's a great way to tease that out. Okay, 2 questions. As the ankle joint axis is offset by 8 to 10 degrees to the transverse plane, can the brace be adjusted to mimic that to allow frontal plane? So yeah, it's a really good question. I will say, Ramsey, that so this brace was actually developed by orthopedic surgeons, and I think they actually do have an offset. So it's not perfectly creating an axis of rotation about the sagittal plane. So ideally, I 100% agree with you in that, that might have a little bit more to do with what exactly it is that they were trying to accomplish. Their reasoning behind this was they didn't like any other brace that was out there on the market, and so they wanted to create something that had a little bit more opportunity to be, I guess, more anatomical and less, restricted in terms of the physical planes of motion, as we look from the anatomical position versus, actual movement to allow the frontal plane. Yes, absolutely. And I think that we see this. So I did a couple projects in ankle taping, for example, and the impact it has on the knee and the hip due to the relative amount of I guess you could call it over support, and why you want to be a little bit more specific and detailed instead of just creating your typical basket weave taping technique that we learn in athletic training. Do you think insole could progress to measuring jump analysis data for a skier specifically when
Is it really because there's the Winter Olympics right now, so we think about skiing, or
someday? So I'll let Giannis answer that, but it's funny because
thank you, Chris.
I've got some thoughts.
Yeah, so for now it's not really, I mean, it could, I mean, as we are discussing, we are progressing, especially in the sports area. We have just onboarded a new person who's going to help us, especially on the performance and the sports analysis overall. So there will be a lot of improvements in the sports. On skiing, I can't really say yes right now, because it's all a matter of focus and opportunities. But technically it could be it's a matter of how what kind of opportunity it can bring, and how eager the market would be to have this kind of information. But yeah, I mean, on our side, as long as there is movement, we could analyze it. Yeah, I would be thank you, Ramsey. So I'll be I would be lying to tell you yes, in the next 6 months we'll have something on that, but at some point we could reach that. So yeah, that's an interesting use case.
Yeah, we and I'll tell you why. I mean, the more we're capable of measuring, I use the example in my class of the injuries that we used to see in alpine skiing, lots of ankles because they were using, softer materials, and then creating a new very rigid boot system. And then we saw a lot of, tibia fibula fractures. So transferring that energy, and then, the influence it has on knee characteristics, and now, and think about the speeds they were going at 40 years ago, 50 years ago, compared to today. And now, so they're going even faster, so we also have to keep up with the materials that are configured. I coach youth baseball, and I've got some of my, 12-year-olds that have more money invested in their bats than I probably have in my car.
Different priorities, right?
Well, so I tell them all, and I tell the parents, I'm like, listen, an amazing bat isn't going to help a kid who can't hit the ball, right?
Yeah, that's. I hope you didn't say it like that, but yeah, it's true.
I'm okay with that. I'm being honest.
So I see that Gunnar asks. Oh yeah, he had a question earlier. It was earlier during the presentation. I missed it. So, symmetry difference, is it defined via the hip, the knee, the fit? Oh, you talked about it. Oh, maybe he missed it. So could
Yeah.
you say it again? I mean, personally, on my side, it depends. It depends where it could come from. It can be very very localized or very generic,
Or
but
yeah, or maybe I didn't treat it appropriately, but I was
maybe
referring to
yeah.
the symmetry characteristic that we represent in the dashboard. And so the
Uh-huh.
one that we represent in the dashboard is relative to the
Contact
walking
time.
profile. So that's looking
Yeah.
at contact time. And so that's not specific to a joint. That's just the overall,
Overall.
temporal dimension of that particular metric.
Yeah. So that's why,
Uh,
to answer if it's defined by the hip, the knee, or the feet, as long as we if since it's defined by contact time, if there is, like, for example, we have examples of people with foot problems, that because they have foot pain, they would just offload to, let's say, on their right foot, they will offload to their left foot, right? So it could be from the hip, the knee, the foot. It really depends the use case or the person. But if it's a patient who has no specific, let's say, pain on the foot or the knee, it could come from, or pathology, it could come from even like back misalignment, for example, or hip misalignment as well. So yeah, so it if there's no particular pain that shows that is brought up, it could come from something higher up, because it would take a bit more time to create pain or long or problem, which would be observed on the symmetry. Like, we have seen people who had injuries like 5-10 years before, and developing a compensation pattern that would create this asymmetry, for example. So it could be very 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 variable in terms of where it comes from.
Yeah, and this is like I use the example when we were
Yeah.
talking about
Yeah.
neurological and neurodegenerative diseases where there's a sensitivity and a specificity, right? So we are very, very sensitive, and then in the biomarkers, we're also attempting to be as specific as possible. But this is where I think in another growth within the product as we're getting stronger in the algorithms is as we input more of this data beyond just the characteristics of the individual, but also some of the history. In other words, they're experiencing foot pain, they're experiencing knee pain or hip pain or whatever the case may be. That Gunnar is going to allow us to be more detailed with the
Yeah.
output and be a little bit more specific.
Yeah. And yeah, it's also the matter of correlation or causation, because you could have, at the end of the day, you could have also a foot pain because you have a like, for example, hip alignment or very bad asymmetry that would create extra excessive offload that would create this pain, for example, as well.
Yep.
So yeah, it's really yeah, you need to check case per case. But if it's, as I said, if there is no like particular pain or like injury that had happened, then it could be from more like a musculoskeletal thing to observe and to check.
Yeah, it's like if you
But
analyze
Gunnar, we
my
could
jump
we could
shot.
also take this offline if you want. Yeah.
Yeah.
Sorry,
If
go
you
ahead, guys.
analyze my jump shot, I mean,
Great
it looks
form.
absolutely perfect, but the ball doesn't go in the hoop, and we don't know why. So
Yeah.
we, we need some further detail.
I mean,
Maybe
I know
I've got
why,
a
but
lazy eye.
all right. Great. I don't know if there are other questions. I know we're off like time. I mean, we've been over time by quite some time. Thank you, Chris, for that. But no, thank you very much, everyone, for staying for so long. We're still quite a lot of people staying.
Yep.
Obviously, as you know, if there is anything, you can reach out to us. Any question, any side question, please reach out. Hannah joined a bit later, so thank you for coming back. As you see, guys, she's well. She's here. Have a great rest of your day or evening if you're on the European time zone. And I mean, you see that webinars are coming back, so we'll keep you posted on the updates, especially on the new version that is coming up in the next weeks. We'll send you some documentation and everything, and reach out to us for any question or anything. So
Yeah.
thank you again, Chris, for your time. Yeah.
Yes, Rana put in the email addresses, and so if you are in an area where you can use a certificate for continuing education or something like that, feel free to email us at the education email, or if you have any questions as well. But thank you, Giannis. I appreciate it, and thank you, Rana, for writing that in there after, so that way we remember to do that and checking up on us and making sure we did okay.
Yeah. Thank you very much, guys. Have a good rest of
All
your day.
right.
Speak
Take
to you
care.
soon. Thank you, Chris. Have a good day.
Ciao.
Bye, Chris.
Au revoir.
Au revoir.